Anorexia nervosa stands as one of the most complex and devastating mental health disorders, characterized by an intense fear of gaining weight and a distorted perception of body image that leads to severe food restriction and dangerous weight loss. This eating disorder affects millions of individuals worldwide, transcending age, gender, socioeconomic status, and cultural boundaries, though it predominantly manifests during adolescence and early adulthood. The condition represents far more than simply a preoccupation with food or weight. It embodies a profound psychological struggle that intertwines with biological, social, and environmental factors to create a perfect storm of mental and physical health challenges. The hallmark symptoms of anorexia nervosa include dramatic weight loss, an obsessive fear of gaining weight, and a severely distorted body image that causes individuals to perceive themselves as overweight even when significantly underweight. Patients typically exhibit restrictive eating patterns, consuming dangerously few calories while engaging in excessive exercise or other compensatory behaviors. They may develop elaborate food rituals, such as cutting food into tiny pieces, eating extremely slowly, or avoiding social situations involving meals. The disorder often manifests alongside perfectionist tendencies, anxiety, depression, and an overwhelming need for control, particularly during times of stress or major life transitions. The psychological mechanisms underlying anorexia nervosa are intricate and multifaceted, involving dysregulation in brain circuits responsible for reward processing, impulse control, and emotional regulation. Neuroimaging studies have revealed structural and functional abnormalities in regions such as the anterior cingulate cortex, insula, and striatum, which contribute to the characteristic cognitive rigidity and altered perception of hunger and satiety signals. Genetic predisposition plays a significant role, with heredity accounting for approximately 50 to 80% of the risk for developing the disorder. However, environmental triggers such as cultural pressures emphasizing thinness, traumatic experiences, family dynamics, and peer influences often serve as catalysts for the onset of symptoms in genetically vulnerable individuals. The physical consequences of anorexia nervosa are severe and potentially life-threatening, affecting virtually every organ system in the body. Malnutrition leads to electrolyte imbalances, cardiac arrhythmias, bone density loss, hair loss, brittle nails, and the development of lanugo hair as the body attempts to conserve heat. Gastrointestinal complications include delayed gastric emptying, constipation, and increased risk of refeeding syndrome during recovery. The endocrine system suffers disruption, resulting in amenorrhea in females, decreased testosterone in males, and impaired growth in adolescents. Cardiovascular complications represent the leading cause of death in anorexia nervosa patients, with bradycardia, hypotension, and structural heart changes occurring as the body adapts to chronic starvation. Social and interpersonal relationships invariably suffer as anorexia nervosa progresses, with patients often becoming increasingly isolated and withdrawn from family and friends. The secretive nature of eating disorder behaviors, combined with the shame and guilt associated with the condition, creates barriers to seeking help and maintaining meaningful connections. Educational and occupational functioning may decline as cognitive abilities become impaired due to malnutrition, affecting concentration, memory, and decision-making capabilities. The disorder frequently co-occurs with other mental health conditions, including anxiety disorders, depression, obsessive-compulsive disorder, and substance abuse, further complicating the clinical picture and treatment approach. Treatment for anorexia nervosa requires a comprehensive, multidisciplinary approach that addresses both the immediate medical complications and the underlying psychological factors driving the disorder. Initial intervention often focuses on medical stabilization and nutritional rehabilitation to restore weight and correct physiological abnormalities. This process must be carefully monitored to prevent refeeding syndrome and other complications associated with rapid weight restoration. Psychological interventions form the cornerstone of long-term recovery, with evidence-based treatments including family-based therapy for adolescents, cognitive behavioral therapy, and dialectical behavior therapy showing promising results in reducing symptoms and preventing relapse. The recovery process from anorexia nervosa is typically lengthy and challenging, requiring sustained commitment from patients, families, and treatment teams. Weight restoration alone is insufficient for full recovery. Patients must also develop healthy coping mechanisms, rebuild damaged relationships, and address underlying psychological issues that contributed to the development of the disorder. Nutritional counseling helps individuals relearn normal eating patterns and develop a healthier relationship with food, while psychotherapy addresses distorted thought patterns, emotional regulation difficulties, and behavioral changes necessary for sustained recovery. Family involvement plays a crucial role in treatment, particularly for adolescent patients, as family dynamics and communication patterns significantly influence recovery outcomes. Parents and siblings benefit from education about the nature of eating disorders, learning how to provide appropriate support without enabling disordered behaviors or becoming overly focused on food and weight issues. Support groups and peer connections can provide valuable encouragement and practical strategies for navigating the challenges of recovery, helping individuals feel less alone in their struggle. Prevention efforts for anorexia nervosa focus on promoting body positivity, media literacy, and healthy relationships with food and exercise from an early age. Educational programs in schools and communities aim to increase awareness about eating disorders while reducing stigma and encouraging help-seeking behaviors. Early intervention is crucial, as research consistently demonstrates that prompt treatment leads to better outcomes and reduced risk of chronic illness. The prognosis for anorexia nervosa varies significantly depending on factors such as age of onset, duration of illness, severity of symptoms, and access to appropriate treatment. While many individuals achieve full recovery with proper intervention, the disorder has the highest mortality rate of any mental health condition, with deaths occurring due to medical complications, suicide, or other related factors. However, advances in understanding the neurobiological basis of the disorder and the development of more effective treatment approaches continue to improve outcomes for those affected. Research into anorexia nervosa continues to evolve, with scientists investigating novel therapeutic approaches, including pharmacological interventions targeting specific neurotransmitter systems and innovative psychological treatments incorporating technology and virtual reality. Genetic studies aim to identify specific risk factors that could lead to earlier identification and intervention, while neuroimaging research provides insights into brain changes associated with the disorder and recovery process. Ultimately, anorexia nervosa represents a serious mental health condition that requires compassionate, evidence-based treatment and ongoing support. The journey toward recovery demands patience, persistence, and hope, but with appropriate intervention and commitment, individuals can overcome this challenging disorder and reclaim their lives. Understanding the complexity of anorexia nervosa helps reduce stigma, promotes early intervention, and supports the development of more effective prevention and treatment strategies for future generations.